everyone. So today's topic is ketogenic diets. I found a meta-analysis which examined weight loss between two different diets, namely the very low-carb ketogenic diet and the low-fat diet. So they compared the weight loss results from these two follow low-carb and those who followed low-fat over a 12-month period. So let's define ketogenic diet. It is if you eat less than 50 grams of carbs per day. This could be 1 cup of milk to add with your tea, coffee in the day, 3 cups of salad for lunch, and 2 cups of green vegetables for dinner. The rest of your daily food will then be made up of animal protein and fats. A low-fat diet, on the other hand, is if you eat less than 30% of your total energy intake, a teaspoon to use as cooking oil at night, with 10 nuts as a snack in the day. The rest will be made up of very lean meat, vegetables and carbs, with no additional fats. Your total carb intake can be approximately 130 grams per day, which is more than double from your ketogenic diet. So let's look at the results. Overall, the ketogenic diet plan individuals achieved only 1 kilogram more weight loss than the low-fat diet plan individuals over a 12-month period. However, their triglycerides, a fat which decreases when you eat less carbs, and blood pressure were lower than the low-fat group. But they also had increased LDL cholesterol, a bad cholesterol, and HDL cholesterol, the good cholesterol, levels over the 12-month period, compared with the individuals on the low-fat diet plan. So some of the explanations for the results can be the following. There are 5 of them. Okay, so number 1. Some studies has found that ketogenic diets might decrease your insulin levels, which in turn will increase your satiety and make you feel less hungry. So your sugar won't go up or down. It will be stable. Number 2, the weight loss difference is not that much because although the weight loss within the first 6 months are more than the low-fat group, the ketogenic people cannot sustain their low-carb diet plan and in the end eat more carbs than they should, and thus only end up losing 1 kilogram more than the low-fat group over the 12-month period. 3. A ketogenic diet will not decrease your basal metabolic rate if you eat less than normally, whereas a low-fat diet plan might decrease your basal metabolic rate. Your basal metabolic rate is the thing that keeps your metabolism going. If your metabolism decreases, it means you are losing muscle. 4th, they found that the ketogenic diet will increase your HDL cholesterol and your bad LDL cholesterol because you eat systolic, maybe the 81 or so. So it can decrease from the ketogenic diet plan. And then in order to decrease your systolic blood pressure, so the top one, they found that you have to substitute the bad animal fats with good fats like avocado. So you can cut off the fats from your meat and eat an avo with it, and then your systolic blood pressure can also drop. Okay, so that was one of the positive things. Let's look at the negative things of a ketogenic diet. Hyperlipidemia is a common side effect. It occurs in 60% of people. So this just means that your bad cholesterol increases a lot. So you should be careful of following this type of diet if you have cholesterol or heart problems in your family. Fatty liver disease can also be a problem here. It will be good to go for cholesterol tests regularly. You can also change all the animal fats to plant fats, like mentioned earlier. Secondly, there have been negative outcomes in adults from vitamin and mineral deficiencies, specifically a deficiency in the mineral selenium, which can affect your heart. So make sure you take additional supplements when following this type of diet plan. And then calcium and magnesium deficiencies can also cause bone injuries, which we as athletes don't want. And then the third thing is gastric problems can occur because you will be eating a high fat and protein diet, which causes delayed gastric emptying. So this just means that the food stays in your stomach much longer than usual because fat and proteins take long to digest. You will have more gastric acid than normal, which can lead to heartburn. So 3 out of 4 people following this type of diet get constipation from the decrease in fiber in the diet. It will help to take a fiber supplement. For instance, AtLife products make a nice supplement called Glucacol 22. Let me just show you a picture of that. So that is the supplement that they make. It just contains nice additional fiber that you can add to your diet. So remember to always increase your fluid intake with your fiber intake to prevent the fiber from swelling in your gut and increasing and then causing constipation problems. So fiber can also on its own cause constipation. And then lastly, the ketone bodies that your body make from proteins and fats can cause your urine to become acidic and contribute to kidney stones. So a ketogenic diet over a long term is not such a good idea unless you want to sit with kidney stones. Doesn't sound fun. So in conclusion, the study states that you can get very good results over a short period of time, 6 months or less, in terms of weight loss and some cardiovascular risk factors. It states that a ketogenic diet will be very difficult to maintain over the long term, 6 months or more. They found that people who changed their lifestyle had better outcomes over the long term. So a normal low-fat diet plan with weight loss lifestyle things is a better thing to do over the long term. So a ketogenic diet plan might be a good option if you want to get back on track after the lockdown for a short period of time. But after you feel you're back on track, switch to a lifestyle diet plan. You can get a DNA test done and get a diet plan created to fit your genes for a lifestyle diet plan. Okay, so this was just an overall thing about what is ketogenic diets. Then next week I will cover how to do ketogenic diet plans in athletes and what's the benefits and risks there, because it's also quite a lengthy thing to do.